4 members of the board of Children's Health Ireland have resigned. 3 members stepped down today, and it was confirmed that another member resigned last week. It follows months of controversy over unnecessary hip operations on children and reviews of other issues. Minister for Health Jennifer Carroll MacNeill said toxic behaviours had developed within CHI over time. Opposition parties insisted that any promised new review of children's surgeries must be independent.
The controversy over Children's Health Ireland's handling of surgeries for children deepened today, with news of the resignation of 3 board members and confirmation that a 4th also resigned last week. The members who have resigned are Dr Gavin Lavery, Bridget McManus, Catherine Guy and Mary Cryan. The Minister for Health said board members had worked in a voluntary capacity and she had not asked them to stand down, as she had no authority to do so. It follows the audit of hip surgery in children published last week, showing a substantial level of surgeries were not necessary at Kappa Orthopaedic and Temple Street hospitals. And at the weekend, news that an unpublished internal report of a Children's Health Ireland investigation into a consultant, which found the doctor had breached guidelines by referring public patients to the consultant's own private weekend clinics. The Minister for Health said a toxic culture had been allowed to develop in CHI.
There have been pockets of very toxic behaviour. There have been pockets of individuals who have been very defiant and who have not gone along with what the board and the executive and the broader thrust of public policy has been.
Today, the heads of the terms of reference of an expert panel who will conduct reviews of hip operations on children for parents who wish to have them done were brought to Cabinet. During leaders' questions in the Dáil today, Sinn Féin said the review must be independent.
Can you assure us also, Taoiseach, that every child who had surgery since 2010, that every single case will be independently investigated and reviewed?
The controversy surrounding Children's Health Ireland has somehow managed to escalate yet again over recent days, and instead of focusing on the vital task of caring for our children, CHI is presiding over an increasingly chaotic string of failures. Failures, Taoiseach, with devastating consequences.
The Taoiseach said there had been a fundamental breach of trust.
In terms of within CHI, there has to be a very fundamental commitment to a multidisciplinary team-based approach across the entirety of all disciplines. The Minister has said that governance is a key issue. I agree with the Minister. I think there has to be a fundamental look at governance as well.
Children's Health Ireland is a separate entity to the HSE, but is funded by it.
And Fergal's with us now in studio. And Fergal, this has undoubtedly all been very damaging for CHI. Is it a case now that radical change is needed, or will it be left to soldier on in its current form?
Well, the pace of events at Children's Health Ireland is remarkable. Hip surgeries on children, many deemed unnecessary, serious spinal surgery incidents and using unapproved springs, a consultant referring public patients to his own private weekend clinics for operations, and this internal report into this affair received by the CHI board in 2022. What did it do on foot of that? Then we have the Minister for Health today talking about the toxic behaviours allowed to develop over time at CHI. CHI it's a separate entity to the HSE. It has its own board and management and has operational responsibility for those 3 children's hospitals, but it's funded by the HSE. So given the run of events, it's difficult to see how CHI can emerge from this crisis in its current form. We've had the resignation of 4 board members, 2 HSE board members are being put on the CHI board, and this expert panel has been set up by the government to offer parents reviews of operations on their children. Those are going to go back to 2010, so it's going to be a long period of time. This is incredibly serious, given the 3 hospitals are due to come together at Tallaght for the new hospital, and it can ill afford to have a toxic culture in its place.